Genomic testing for lung cancer involves trying to understand what are the unique genomic alterations in the individual's cancer. These are what we call somatic genomic alterations, meaning these are alterations in the cancer itself. These are not alterations in the rest of the body. And these genetic alterations are ones that are important in the growth and development of that cancer. Typically, this testing is done in pathology laboratories and done by some form of sequencing, and involves, of course, examining the actual tumor tissue itself that's obtained at the time of a biopsy through a CAT scan guided biopsy or through a surgical biopsy. And it can take anywhere from days to a few weeks to complete. Now, it's important because what doctors are looking for in these tests are for specific genomic vulnerabilities, mutations, such as a mutation in the EGFR or epidermal growth factor receptor gene, or in the anaplastic lymphoma kinase gene, or in the ROS1 gene. And the importance of these findings is that they dictate therapies. So in some instances, when you find a genomic alteration through this testing, that will then trigger a therapy other than, for example, chemotherapy in someone with newly diagnosed with advanced lung cancer that would normally be treated with chemotherapy. If they have a genomic alteration, they can potentially be treated with a pill therapy, an oral therapy that is not only much more effective, but can be much more and much better tolerated than chemotherapy. So it's important as part of the process of newly diagnosed lung cancer to have the cancer be tested for genomic alterations. Most importantly for patients who are diagnosed with stage 4 lung cancer, less important in somebody who is undergoing surgical resection or has an earlier stage lung cancer, although the importance of that is changing over time, as well as we're using targeted therapies in these patients following surgery as well.